Heartburn is something I had to battle with from my second trimester till the day I put to bed. Yes, heartburn is common in pregnancy, but you don't have to suffer. Good day everyone and welcome back to Nurses Lecture Room. My name is Mercy Mary, popularly known as the Nurse with a Difference. And on this video, I'm going to be sharing with you 5 tips to help you relieve heartburn during pregnancy. And at the end of this video, I'm going to tell you when to consult your doctor. But before we go into details into this class, if you are new on our YouTube channel, please click on that subscribe button, turn on that notification bell so you don't miss out in any of our videos. Alright, welcome back. Before I share the tips to help you relieve that heartburn in pregnancy, there is something I want you to know, and that is what is happening that is causing that heartburn in pregnancy. A lot of people believe it's spicy food, but it is more than just spicy food. It's not just spicy food. Something is happening with pregnancy that is causing that chest burn, that heartburn. Okay, so what happens is that when you are pregnant, there is a particular hormone known as progesterone. This particular hormone increases, and because this hormone increases with pregnancy, it causes the muscles to relax. And the stomach muscles, that's the valves between the stomach and the esophagus, they are not left out. The muscles around that area are not left out. They are also relaxed. So what happens is that when you eat, the acid tends to rise back. Because the muscles are relaxed, it can easily go back to the esophagus area. I don't know if I'm making sense. So that is one of the reasons, and increase that hormone. So that heartburn, we need to blame that hormone for it. Is the major thing that is causing that heartburn in pregnancy. And also, as the baby bump increases, it tends to put pressure on the stomach, which increases the acid content to rise out and gets to the esophagus. So that is what is actually causing that heartburn in pregnancy. Now, let's talk about the tricks. The first trick I would like to share with you is eat smart. What do I mean by that? It is better for you as a pregnant woman to eat small, frequent food than larger ones. So larger ones, instead of you to eat the full bowl once, it's better for you to eat it little by little but frequently. All right. And it's also advisable for you to have non-acidic bland diets. And it is very, very much okay for you to eat slowly, chew calmly. You don't eat rush like very, very fast. You don't eat very fast, but rather eat calmly. And when it comes to eating smart, it is advisable for you to avoid spicy food. It's advisable for you to avoid greasy food. It's advisable for you to avoid caffeinated and carbonated drinks, because that is going to increase the chances of you having frequent heartburn. Then the second trick I would like to share with you is stay upright. Yes, you heard me right. Stay upright. Sitting upright is going to help a long way, because when you are lying flat, you are sending your stomach to bring everything up. But when you sit upright, it actually reduces the risk. And also, if you want to go to bed, it's advisable for you not to eat 2 to 3 hours before bedtime. At least the food has already gone down. But if you eat like when you're in bed or few minutes before you go to bed, that might also increase your chances of going down with this heartburn. And when you want to sleep, try as much as possible to put like a double pillow instead of one pillow. That's going to keep your head elevated rather than lying flat. So it's very important for you to stay upright when it comes to heartburn. Then the fourth tip I would like to share with you is drinking enough water. Hydration, yes. Drinking a lot of water during the day can go a long way to help. What I advise pregnant women to do is to get a bottle that you can easily measure the amount you drink at a particular time. You can say, oh, I want to be taking one meal every 1 hour. I want to be taking 10 meals every 1 hour. Just aim it to be taking water regularly, frequently, little sips at a time. That is going to go a long way to help. But don't take a large volume of water or large amount of water with meal, so your stomach doesn't get full and cause that acid reflux to take place. All right, so hydration is generally very important. So you can take some herbal tea, you can take some milk during the day. that is also going to help. Generally, hydration, drinking a lot of water is very important for pregnant women and also breastfeeding mothers. Then the third tip I would like to share with you is clothing and movement. Yes, if you are pregnant and you're experiencing heartburn, try as much as possible not to wear tight clothing. Try as much as possible to wear loose clothing, so that tight clothing doesn't put a lot of pressure on your stomach and causes the acid to rise. So wear loose clothing is going to help. And also in the part of movement, after eating, you can do some walk, like walk around, to help with digestion before going to bed. Then the fifth tip I would like to share with you, which is the last tip, is natural remedy. And one of the natural remedy is having to chew a sugar-free gum. That actually helped me a lot. There are some nights that it was really a struggle, and the only thing for me to stay awake, like to help with the chest burn, I mean, is to have a sugar-free gum. I had to chew the gum for some time, and that helps to relieve it. It helped me a lot. And another tips that can help you when it comes to natural remedy is having yogurt. Yes, the probiotic yogurt, your Greek yogurt, I usually have that. That helped me a lot with it. You can have some bananas that can help you soothe that that effect of that heartburn, that acid at that particular moment. So these are the tips that you can give a try that's going to help you. Then also, when you notice that this heartburn is persistent, is consistent, even with this tip, it's not helping, and now you are having difficulty swallowing, you're having persistent nausea, it is very important for you to see the doctor. It is very important for you to see the doctor. Close to the end of my second trimester / beginning of my third trimester, it was really severe that I had to see the doctor, and the doctor prescribed some safe antacids for me, which I use it. But most times I use the natural remedy. The times where the natural remedies are not working, I rely on the antacid. So I wasn't really taking the antacid frequently. I usually try the natural remedy, then go for the antacid when it's really beyond my control. Okay, so these are the tips I have to share with you, and I hope it's beneficial. If you have any struggles in regards to pregnancy, please contact your midwife, please contact your doctor. This is just an educational video and should not in any way be replaced with what your physician is saying to you. Thank you very much for staying tuned. Thank you very much for watching this video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Nurse Mercy Mary saying thank you. Bye, and see you in our next video.